Good morning, good afternoon, everyone, and good evening for some of you. Thanks for joining us for today's 1-hour free webinar from Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch, and I'm CEO and founder at PPW, and happy to be spending time with you. This is your time, so if you have any questions, if you have any comments, if you have anything you want to say, this is your platform. You can do that through the chat option or the Q&A option. You probably know how it works by now with everybody, with the pandemic, everybody spending so much time on Zoom and other conferencing platforms. So feel free anytime to make any comments that you want. And we look forward to hearing those and looking at those. So we've got about an hour together. I'll be sending you these slides, so no worries if you've got to cut out early. I'll send you a link to this recorded webinar, and also you'll get a certificate for your 1-hour time with us. So you can see today's topic. I really wanted to spend time with people who are interested, really reviewing, sort of introducing, if you will, all of the Prevention Plus Wellness programs, media campaigns, and professional training opportunities that we offer for prevention and health and fitness and whatever specialists throughout the country, throughout the world, in fact. So we're happy that you're able to join us. So I'm going to go ahead and launch right in. We've got 3 objectives for today's webinar. And you can see the first one, you'll be able to list the program, all the PPW programs that we offer, the media programs that we offer, and the professional training opportunities also that we offer at Prevention Plus Wellness, or PPW. Then secondly, we're going to review the components and the materials of these programs, media campaigns, and training. And then we'll also be discussing under number 3, how prevention and health specialists and like yourselves and organizations from across the globe can implement these PPW strategies, prevention plus wellness strategies. Okay, do you have any questions at this point? If you have any questions, you have any comments, feel free to type that into the chat space or the Q&A space, and I'm happy to answer them to the best of my ability. All right, well, let's go ahead and take a look at the Prevention Plus Wellness programs first. This is a listing of all of our programs to date. And I just want to say that we are continually building upon these programs based on the feedback that we get from specialists like you. So professionals like you, we really rely on you telling us what you need. Of course, we have a particular model that we're very proud of, and not just that, even more importantly, that we feel and are committed to being essential to improving the overall physical and mental health of youth. And that is single programs that integrate substance use prevention with the promotion of healthy lifestyle behaviors. So all of these are addressed within our single Prevention Plus Wellness programs, no matter which one you see here. So let me go down this list with you and give you an overview, and then we'll have more content, dive down a little bit more into what these are. But this is just an introduction. So if you want to find out more, you can go to our website, preventionpluswellness.com. That's preventionpluswellness.com. And you can look under programs, and you'll see all these programs, including our media campaigns as well, that we offer. And under training, you'll see our training, etc. So preventionpluswellness.com is the good place to start to learn more. But you can always email us as well if you want to see a sample of any of our programs. So all you have to do is email us at info at preventionpluswellness.com. That's all spelled out, preventionpluswellness.com. So let's take a look at these programs, starting with number 1, sport. That was our original initial program, a sport, which is really an alcohol and drug prevention plus wellness program. We've got versions for high school, middle school, and elementary school youth. So sport was the initial, as I said, the initial intervention. And it was for young people. And we focused on alcohol because it's the most prevalently used substance. And I think that's pretty much everywhere in the globe. It's the number one substance of use, and of course misuse among young people throughout the world. And so that's why we started there. Sport it's not really an acronym, although we did put some words to it. People kept asking us, what does it stand for? So we put some words that I don't recall it there. It's really, the idea was that sport is it addressed an image, obviously sport PPW program addresses sports and physical activities and other healthy behaviors. So that's where the name comes from. It really doesn't have an acronym. So that I remember anyway. So that's sport prevention plus wellness. Then came In Shape prevention plus wellness for young adults. This is for, by the way, you got sport that addresses children. We've got organizations that are implementing it to certainly fifth graders, fifth graders, fourth graders, maybe even some third graders. So I would say about age 8 to 10. The middle school version, young adolescents, for those ages 10 to 14 roughly. And then the high school version, older adolescents ages 14 to 18. In Shape is our young adult program for those ages 18 to 25. So really we got programs that address the whole developmental period of children, young adolescents, older adolescents, and young adults. And of course that period really, that period over time increases the risk for substance use and other chronic disease risk behaviors like physical inactivity, poor nutrition, lack of sleep. So as young people transition from children to young adolescents, there's increased risk. From young adolescents to older adolescents, further increase in risk. And from older adolescents to young adults, that's where the risk peaks generally and then levels off or even decreases somewhat. So that's why prevention and health promotion very important across all of those developmental stages. So In Shape is for young adults, and that includes young adults in colleges and community settings. Even the military is using our In Shape program. Then we have two adaptations of sport, vaping prevention plus wellness, which addresses e-cigarettes, and the marijuana PPW program. Both of those also come in high school, middle school, elementary school versions. They're adaptations of sport. So essentially what we did was we took out the sport, we took out the alcohol messages, and for a vaping PPW, we put in e-cigarette messages. Same with marijuana. We took out alcohol messages, put in cannabis messages. So if you've got sport, you've got a program that addresses how alcohol interferes with being physically active, nutrition, sleep, stress control, and other risk factors associated with alcohol. With the marijuana PPW program, obviously the focus is on cannabis, how cannabis interferes with healthy lifestyle and behaviors, as well as other risks associated with cannabis use. So that's the difference between sport and vaping and marijuana PPW. Number 5 is our opioid prevention plus wellness program, a little bit different. This is actually based on the In Shape program. And the opioid PPW program, as you can see there under number 5, comes in an adolescent version, and then also high-risk young men version and a high-risk childbearing age young women version. Those 3 versions were developed because SAMHSA, the Substance Abuse Mental Health Services Administration in the United States, said those are 3 high-risk groups. So that's why we developed programs addressing preventing opioid misuse or non-medical opioid use or prescription misuse, however you want to phrase it. That's what the opioid PPW program addresses. Sport 2, under number 6, is our only multi-session program. It's 6 sessions, and it comes in high school, middle school, elementary school versions. Now, Sport 2 was originally designed to follow up with sport. So some organizations will implement sport for one session. All these programs are one session except for sport 2. And then if you had access to high school kids, middle school kids, elementary children, you could implement all or some of the 6 lessons of sport 2. So that's why sport 2 is developed. Sometimes some organizations will go directly and implement sport 2. Okay, so I see a hand raised. Let me go ahead and grab that. I don't see a message though, but let me see here. Okay. I may not have seen that properly. Anyway, so go back to it. Number 6, sport 2. Have any questions about it? Let me know. Number 7 is a video program, the sport program. So we took the sport high school program, which can be used for middle school as well, I believe, and we converted it into a video format. So you don't need the program manual, you just show the video. So that's what we did there. We'll talk more about that in a minute. We also have a racial justice prevention plus wellness program. Research shows that racial injustice, racial discrimination, is a risk factor for youth substance use. So we wanted to address that. So we addressed racial injustice by having a racial justice program and getting young people involved in that and educating them and motivating them. In that regard, we'll talk more about that. In God's Image is our spiritual practices program. That's in a digital download and it's completely free. Just go to our website, type in preventionpluswellness.com, go to programs, go to In God's Image, type in your information, your contact information, and it'll download for you for free. We also have, you can see under number 10, parent programs, parent PPW programs. So we created these so that you, as a prevention and health specialist, if you wanted to, if you had an interest to, you could train parents and caregivers in a single session to provide the same positive image and behavior communication and goal setting at home with their youth that you could also be providing directly to youth with our other youth programs, whether it's sport or in shape or vaping or marijuana or opioid, PPW, et cetera. So that's what the parent program is about. It's about getting parents on board, teaching them, helping them, giving them resources so that they can communicate positive behaviors, positive image, motivate their youth, have them set goals, and have that reinforcing message at home that you might also be providing in schools and communities and boys and girls clubs or YMCAs or whatever the sports, whatever the setting, using your your youth PPW program. So that's what the parent program is about. Lastly, number 11, brand new. We know that most of our programs are a single session. There's screening and brief intervention, there's motivation. You motivate youth to set goals to avoid substance use and to improve their healthy behaviors, and that's it. But some organizations and professionals wanted to track youth. They wanted to keep an eye on youth. They wanted to continue to motivate youth and encourage them to set weekly goals, and in between those goals, every day monitor their goal achievement. That's why we created number 11, the PPW Goal Plan Tracking Program. So it's a brand new program. And so I think for those of you that want to continue to stay in contact with youth, either by email or phone, continue to monitor their goal setting and their goal tracking, their behaviors, you can do that with this particular online program. I'll talk to you more about that as well. Let's take a look now a little bit more in depth about all these programs, starting with sport. There's from the left to right, elementary, middle school, and high school version of sport. This is the cover of the manual. You actually get a physical manual. And here's some content, some description of the sport alcohol drug prevention plus wellness program. It is evidence-based. That means we've had a number of community-based trials evaluating the outcomes of sport and found and published those findings in refereed scientific journals, professional journals, and then and only then were sport listed on evidence-based registries. By the way, we're going to be presenting on another webinar coming up here where we just go through some of the dozens of evidence-based registries listing our programs, particularly sport and InShape. So the research shows that sport is effective in preventing alcohol, tobacco, cannabis, increasing physical activity among participating youth for both non-using and substance-using youth. So good data, good evidence supporting sport across multiple substances and health behaviors. Sport addresses alcohol and other drug use, but also at the same time promotes physical activity and sports, healthy breakfast and nutrition, sleep and stress control. Sport PPW is the single session program. We say less than 50 minutes, but really it's very flexible. You could implement it as short as maybe 40, 45 minutes, and you could take longer than that, obviously. You could stretch it out if you want to. It's a screening and brief intervention, as all Prevention Plus Wellness programs. Your Sport Prevention Plus Wellness program is presented to youth with slides. You have in your manual a script to provide it to youth individually or in a group. So it can be used as a universal prevention intervention for all youth, or it is being used throughout the country and other places as a selective or indicated intervention. In other words, for high-risk youth, like those who have been caught for already using substances, and you can present it again to them individually or in a group. Prevention Plus Wellness programs, including sport, are based on the behavior image model theory, which targets positive images of youth and goal setting, which those two components are designed to motivate youth, number one, with the positive image communication, and then the action piece to get them engaged in behavior change is the goal setting. Sport Prevention Plus Wellness programs include a letter to parents and 4 weekly flyers. So there is a small parent component to it if you want to use it. Your Sport PPW program comes with a physical manual, like I said, but also a link to all the reproducible materials, a digital download, if you will, of all the reproducible materials, your slides, and anything you need to make copies of, your flyers, your screening survey, your goal plans, pre and post tests, etc. And there is online protocols within the slides to present your lesson virtually if you have to. You can present it in person, obviously, as you would prefer, I'm sure, most of you, but with the pandemic and things going on, or maybe you just have people, youth, you could reach more youth virtually, you can present this on Zoom or Microsoft Teams or any other virtual platform because it's built into the PowerPoint slides. So no worries, you can present this in person, you can present this virtually. That's the sport program. Here is a table of contents sections of the program, very similar to most of the programs. You've got introduction, you've got step-by-step directions for implementation, you get a copy of a screening survey and goal plan. The screening survey and goal plan are shown in the manual, but they're also in your digital downloads, so you can make copies of them and hand them out to youth when you present the lesson. You've got in section 4 or chapter 4, you've got a individual feedback lesson script. Section 5, the group script, where you present the lesson to 2 or more youth at a time. You've got built-in evaluation materials, which we'll go over in a minute. So you can evaluate and assess the quality, the fidelity, and the outcomes of your program. A follow-up parent flyers, as I mentioned, and even a online link if you want to send to youth to have them continue the goal set. Sport and all Prevention Plus Wellness programs follow this 3-step evidence-based screening and brief intervention SBI process. Step number 1, you screen youth for their health behaviors. In sport, it's alcohol use, as well as their health habits, physical activity, and sports, breakfast, etc. Step 2, you provide positive feedback on each of those behaviors. You address sports, you address physical activity, you address breakfast and nutrition, you address sleep, and you certainly address alcohol and drugs. That's the feedback you present. You show positive image communications and positive image terms like fit, active, healthy, successful. This is designed to cue unconscious images of young people of themselves in the future. They want to be fit, active, healthy, successful, etc. We all want those things. We want those things for our young people. And that is very, very motivational. Those self-images, those self-identities really are almost universally desired among young people, as well as, I would say, most adults. And you link during this feedback session, step 2, you link how substance use for sport, again, it's largely alcohol, for vaping, PPW, it's e-cigarettes, etc., how those substances interfere with your health behaviors and achieving those desired images. The third step after screening and feedback is goal setting. That's the action piece. And then you walk young people through goal setting, not just to avoid substance use, but to increase healthy behaviors. And to the extent that you continue to encourage them or track them, then what happens is they'll develop self-regulation skills, and they'll develop self-efficacy, confidence in their behaviors to start shaping their own lifestyle. Really, really good stuff. 3-step evidence-based screening and brief intervention process. And this is a bit of a review, but I thought I'd show it to you nonetheless. This is the list of all that is in your Sport Prevention Plus Wellness program, and most of these things are in the other PPW programs. As I mentioned before, you've got step-by-step implementation directions. You've got a brief self-administered youth health and fitness behavior screening survey. That's part of the intervention. You want them to think about their health habits, increase their awareness of their behaviors. Step number 3, these are not steps, these are materials, includes your scripts for providing your feedback lesson to one youth individually, one-on-one, or to a group of youth. You've got under number 4, your colorful slides for the visual learner. Number 5, the goal plan contract for action. Number 6, online and paper youth pre-test and post-test surveys. So you actually have 2 versions. You have the paper version of the pre-post survey, which is fine because you can collect it, but then you have to hand enter the data. So, and we could send you a link to hand enter the data into a template. But if you use the online links that we could send you, customized online pre and post-test links, then you don't even have to touch the data. The youth enter the data. Number 7, an instructor survey. That's a self-assessment tool that you use to assess what was the quality of your implementation of your lesson. A really good tool to track quality of presentation over time. A fidelity checklist. Then there's a letter to parents about the follow-up flyers, and 4 weekly flyers, which you can hand out, mail out, email, post on your website. That's a separate intervention altogether, the flyer. So you can choose to use it, you can not use it, but it's a great extra tool in your manual. There's also a phone protocol if you want to call parents to see if they've received the flyers. Number 12, there's an online follow-up goal plan. 13, we always provide support as much as we can to all of our users, and you could reach out to us under 14, email, phone. We could hop on Zoom, whatever. We support you as much as we can because we want you to have success. We want to see positive outcomes for you and your youth. That's why we have built-in evaluation, and that's why we support that evaluation. And lastly, we have training. Very, very, very important to get some training. We'll talk about training here in just a bit. That was sport. In Shape is the young adult version of sport. It is also evidence-based. That means it has been evaluated in a number of randomized trials. It's been shown to prevent alcohol and cannabis including heavy alcohol use and heavy marijuana use, and drinking and driving, increasing physical activity, sleep, health-related quality of life among young adults. It targets alcohol and tobacco, physical activity, eating, sleep, stress control. It's a little bit longer than sport, I would say about an hour. Again, screening and brief intervention. You get a manual, you get slides, you get implemented to one young adult at a time or in groups based on the behavior image model, using those positive images to increase motivation for change. You get a digital download. You can present this virtually as well. That's the InShape program. In addition to InShape, we've got these two programs that are adaptations of sport, of vaping, PPW, which is e-cigarettes, high school, middle school, elementary school version. Marijuana, PPW, high school, middle school, elementary school version. And we've got the opioid prevention plus wellness program, adolescent version versus, and young men version and young women version. All three of these programs, vaping, marijuana, and opioid prevention plus wellness, we usually refer to them as evidence informed, but remember, they do use the evidence-based practices screening and brief intervention format. So these three programs address these emerging, continually changing, substance use risks of opioid and e-cigarettes and marijuana. As I said, they're based on sport or InShape. They target, of course, different substances depending on which version you use. Obviously, opioid, PPW addresses opioid misuse, but they all address physical activity, nutrition, and breakfast and sleep, and stress control. Single session programs with slides, with a manual, with a digital download based on the behavior image model, etc. The 6-session sport prevention plus wellness comes in high school, middle school, elementary school version. And these are the lessons. These are the topics of the lesson. Now, remember what I said earlier, many organizations will implement sport, which addresses all these behaviors together first, and then we'll implement all or some of these individual lessons of sport too. Moderate intensity physical activity, vigorous intensity exercise, muscle strengthening, physical activity, healthy nutrition, monitoring food and calorie intake, and then lesson 6, sleep and stress control. So you can implement all of these lessons. You can implement some of these lessons. It depends on your access to your youth, their needs, your needs. And so a lot of flexibility with the sport 2 prevention plus wellness program. Let's talk about racial justice, PPW, and in God's image. So racial justice addresses racial discrimination. In God's image addresses spiritual factors. Let's look at racial justice first. It targets these 4 items under the yellow section in the middle of the right side of your slide. The focus is getting youth to contemplate, to observe, to learn more about, and then lastly, action to help prevent racism and social inequity, both in their school, their community, and virtually. So really, really good goals. The focus is on racism, racial prejudice. We all have certain biases, and we teach that to youth in the racial justice PPW program as a risk factor for substance use. Then in God's image, also it addresses physical activity and nutrition and avoiding substance use, but it also targets increasing your spiritual practices. Could be scripture, could be praying, et cetera, et cetera. That program is for free, and you can get it on our website, preventionpluswellness.com, under programs. Go to In God's Image, click on it, enter your contact information, and download it. That's racial justice in God's image. Now let's talk a little bit about the video program, the sport video program. We took sport and we translated it into a video. So what you can do is, this is, sustainable. You have the video, you can use it forever. It's interactive. adaptation of the sport manual program. You don't need a manual with the sport video program. So this is maybe a little bit easier to implement for maybe coaches or maybe juvenile justice. So that's why we created it. Really dynamic images of young people engaged in healthy behaviors, physical activity and sports and nutrition and sleep, stress control. And you show your video to your classroom. And the video will tell you, stop here if you're going to use a pre and post test survey to evaluate your video. Stop here and provide your screening survey. So your video comes with a download of the screening survey, you make copies of it, you hand out to the kids. Stop here in the video to have your youth complete a goal plan, and you can walk your youth through the goal plan. So it's all video driven, very, very easy, no manual, no need to practice your script because it's all covered. And the three components of all of our screening and brief interventions is addressed in this video program: screening, feedback, and goal setting. That's the sport video-based program. As I mentioned, we have adaptations of our programs for parent training, where you can actually train youth in one session to provide these same positive image communications and goal planning at home. So what we've done, I say it's not here on this slide, but we have parent programs for sport, which obviously addresses primary alcohol, the vaping, e-cigarette program, marijuana program, opioid program, and In Shape for young adults. So with this program, with the parent programs, you get PowerPoint slides, you show them to parents, you let them practice, and it's very, very simple. It's very easily laid out. You get your PowerPoint slides. That's number one. You get instructions for implementation. And number three, you get a guide that you make copies of for your parents, so they can take that home and continue to provide that positive communication, lots of resources for those parents, and even goal plans so that they can encourage their youth to set goals at home. That's the parent program. What's the appropriate age group for the video program? That's a good question, Samantha. We really created it from the sport high school program. We believe it can be used, but the images are high school, middle school. So we believe you can use the sport PPW program for adolescents in general. Okay, good question. Thank you for asking that. Parent program, any questions, let me know. Then we also have an unlimited programs license. So the unlimited PPW program license is really for those that really want to have make it really enhance their footprint in terms of reaching everybody in their community, in their region. So this will save you money if you're going to hand out more than 10 manuals, because this program will let you make copies, unlimited copies of your individual PPW program. So you can make unlimited copies of any program, video, parent material. Manuals are owned by you. Once you make the copies, they're yours even after the 3-year period of this license. You can get discounted prices on updated programs. Very cost effective if you want to reach large numbers. If you want to have put in the hands the manuals to a lot of teachers and coaches and even youth leaders and so on, the the unlimited PPW license is something for you to look into. And then if you can get 1 or 2 people trained as trainers, then they can go around and train everybody. You can print out the manuals, hand the manuals to professionals, specialists for free, train them for free. Or we also have an unlimited online training license as well. You can get it. So between the online unlimited programs and the unlimited training, you can train literally unlimited numbers of individuals in any of our programs, give them the manuals, give them the training, and really increase your prevention plus wellness footprint in your region. The most recent program that we've created, and we're still testing it out a little bit, but we feel it's going to work really well. It's the PPW Goal Plan Tracking Program. This allows you to follow up on your youth, to track your youth weekly goal planning and daily goal monitoring. You can see if they're hopping online and setting new goals every week, and if they're hopping online every day and recording whether they're achieving or not achieving their daily goals. So you as the teacher simply add your students' names and emails, they're notified, and then you could track them. You could see whether they're hopping online, you could see what kind of goals they're set. So it's a really good tool to keep an eye on youth, to encourage youth, to motivate youth, to continue this process of weekly goal setting, and in between every goal setting, monitoring their goals every day. Really, really good tool. And that's the PPW Goal Plan Tracking Program, brand new from Prevention Plus Wellness. PPW programs are listed in provided in all 50 states and abroad. I will just say, you can see this list. Anywhere there's youth and young adults, you could implement your single session Prevention Plus Wellness program. Very, very flexible to youth individually or in a group. How about our media campaigns? We've got 4 brand new media campaigns. We've updated, we originally had a marijuana PPW media campaign that's been updated and revised and brought up to date. We now have a sport, which is alcohol media campaign, a vaping e-cigarette media campaign, and opioid media campaign. So these are all campaigns. So we know a lot of organizations like to reach large numbers of individuals. These include students, youth, but also adults in your community. And these media campaigns are designed for that. So they're ready to use, they're fully loaded, save you tons of time and money. You can add your logo, you can tailor it if you want to your population. You just download it and the material is yours. As far as the content, it's adapted from the behavior and image model, BIM model theory, positive images. It's adapted from our PPW programs. So for example, our marijuana PPW media campaign reflects at least some of the content of the marijuana PPW youth program. And then there's additional evidence-informed content sources like Centers for Disease Control. So it's an expanded version, essentially, of our individual youth, of our youth programs, these media campaigns. Number 5, the content in the media campaigns targets drug use risks, norms, media influences, increasing awareness of youth, the media influences promoting substances, presenting positive role models for youth. Screening, health behavior screening and goal setting is included in the PPW media campaigns. Promoting healthy behaviors is the focus. Includes both print media and social media, includes posts that you can put on social media, includes videos you can put on, includes online pre and post surveys so you can evaluate the outcomes, including risk and protective factors and health behaviors of your media outcomes on your youth. So if you take a look at the media campaigns, let's just start with marijuana. You can go down the list. There's just a ton of information here. You've got banners and posters, which you can make copies of. You can post them electronically. You can put your logo on if you want. You've got a marijuana PPW media campaign press release. So it gives you lots of content there to tailor a press release or multiple press releases to get the word out on what you're doing and to get visibility. And that you could share with your all kinds of media, the electronic media, as well as the standard media, radio, television, et cetera, print. Then you can see some of the materials. There's a youth cannabis use and risks quiz and answers and scoring guide. There's essential marijuana terms, a document. There's what should we tell youth about marijuana use and how it affects physical activity. 10 marijuana risks brochure, 9 myths about marijuana harm flyer, 10 marijuana and alcohol harm reduction tips for parents. See, so we do bring in content, especially for parents. 7 tips for reducing marijuana risk, 7 critical factors about synthetic marijuana. And then continuing, is marijuana really safer than alcohol? Of course it's not. And why is marijuana use addictive? Youth PPW Health Behavior Survey, Youth PPW Multiple Health Behavior Goal Plan, because we are in this media campaign using the screening surveys and goal plans, because that's part of the the media campaign goal is to not just increase awareness, but we want youth to think about their health habits and to set goals. So it is behavior change oriented, all PPW media campaigns. Marijuana marketing literacy, PowerPoint slides. So you can, and related to that, a quiz and answers, a scoring guide. So you can really educate youth in groups if you want to about marijuana marketing. Really good content there. Social media posts with content and illustrations, promoting youth healthy habits while avoiding marijuana use. Social media mini videos. You got a half a dozen mini videos you can send out. Again, the focus is on healthy behaviors, avoiding marijuana use, marijuana risks, and getting youth to think about their health habits and to set goals. And an online youth pre and post health behavior evaluation survey. Similarly, we've got the sport media campaign, very similar parallel content and strategies, but addresses sport, addresses alcohol. And you can see some of the things here. You got the parent flyers here. You've got myths being addressed. You've got, negative effects of underage drinking. What is alcohol use disorder, et cetera, et cetera. There's 2 pages, lots of content and materials and tools in the sport alcohol PPW media campaign. Same with the vaping e-cigarette PPW media campaign, lots of content there. What's juuling, what's better than juuling, parent tip sheets, and again, lots and lots of content ready to use. These things can be implemented by you, but you can also get your youth to help implement these media campaigns. And there's the opioid PPW media campaign, focuses on opioid misuse and truth about opioids and facts for youth, et cetera. And lots and lots of ready to use, ready to implement your media campaigns from Prevention Plus Wellness. How about training? What kind of professional training do we offer? First and foremost, I'd recommend our self-paced online training because it's interactive and yet you can follow it at your own pace. And in addition to any particular training, let's say, and by the way, the training focuses on you implementing, giving you the skills, the knowledge, and the confidence to implement any PPW program. So let's say you're going to be implementing the sport high school program. You can then take the self-paced sport high school program implementer training. And it also comes with an additional prerequisite training, very brief PPW core knowledge. So you get the PPW core knowledge and you get the how to implement your program. If you have your manual, it walks you through the manual, and really, really good training. That's the self-paced. And you can go through it as quickly as you want, saves time. And but again, there's narration, there's assignments, there's quizzes. You'll find it, I think, very entertaining and engaging. We also still have the live 2-hour training if you want to have that. We have live training of trainers. So once you implement your program, you've been trained as an implementer, you implement it once, you're eligible for number 3, the online training of trainer, if you want to then turn around and learn how to and get resources to train other providers in your region. It could be teachers, could be coaches, prevention specialists, even youth leaders. We also do inline program implementer and training of trainer workshops. and of course, these free weekly or somewhat weekly webinars. Just a little bit more about the self-paced training to give you a little bit more flavor and sense of what it is. You gain the knowledge, confidence, and skills to provide your particular PPW program with quality, with fidelity, with effectiveness. This training you go through at your own pace. You start it whenever you want to start it. You get 14 days to complete it, but literally, I think most people are actually completing it in about an hour and a half. So, but if you need to step away and come back, you have that opportunity. Very interactive, includes the PPW core knowledge lesson, and it certifies you as a program implementer for 3 years. That's the self-paced training. Online train-the-trainer, this is where we walk you through and give you the skills and the materials to go train other implementers in your organization or your region. It's a 3-year certificate as well. But the prerequisite is, first of all, you have to be trained and implement any of our programs one time, and then you can come back and become a trainer to train others to implement that program. We also have, as I mentioned earlier, an unlimited PPW program online training license. So for 3 years, you can invite anybody to log into our self-paced training and get them trained. So if you bought the unlimited program license and the unlimited training license, you can hand out manuals and you could send people to the training, and you can really get lots and lots of people with materials in hand, training, ready to go, and really expand your Prevention Plus Wellness footprint throughout your county or your school district. Want more information? Go to preventionpluswellness.com. By the way, that link on the left is to our catalog of our programs. The link to the right is to get a free sample if you want to request a free sample of any of our programs. Preventionpluswellness.com is our website. info@preventionpluswellness.com is our email, and 904-472-5022 is our phone number here in St. Augustine, Florida. All right, I'm going to pause here. Thank you guys for listening. Thank you for all you do. God bless you for all you do for youth and adults in communities and families in your region. I'm going to pause here, and if you have any questions, if you have any comments, log into the chat and let's take a look at those right now. So Samantha had asked the question earlier, and again, you know, what age group can you implement the sport PPW video-based program? I would say adolescents, high school, middle school. Rhonda says thanks, and I say thanks to Rhonda and everyone here for all the work that they do and making a difference. You guys are really prevention heroes, and you don't get recognized, but I recognize you and thank you so very much. So Yami says thank you, Yami. Again, you just got another couple more minutes. If you have a question, if you have a comment, now's the time to do it. You've got a platform. You can say anything you like to your professional group here. We got people from Africa, from South Korea. We got people from Washington to out west, all the way to what was the furthest eastern? I don't remember. Ohio. So we don't have a huge group on this because I think a lot of people have already broken and are now starting a little bit of a break before they go into summer. But I appreciate everybody who's here. This is the core. This is the group that counts, that we're all here together. So here we got somebody from Nigeria. I got a chance to anchor a radio program on sport. I need advice on what program I need to take to be prepared. So I would recommend this. I recommend you, again, our programs are designed to be implemented to youth, individually in a group, or if you took a media campaign, that could be something that you could really promote and implement through a radio program as a part of it, to youth, to parents, and you could tailor that as well in your setting. But we also have, I'd be remiss if I didn't tell you, do go to our website, preventionpluswellness.com, and go to resources, because we do have a bunch of free resources that may be very helpful for you as well. So if you don't have a budget for prevention, there's free resources as well on our website. So do check those out and let me know if you have any questions and if I can help you in any way. We'd love to have our programs implemented in Africa. We've had lots and lots of interest. There's a heavy emphasis, I think, in a lot of countries in Africa and other parts of the world on youth sports as a prevention strategy. And our programs can be easily implemented in and through sports participation and beyond sports. So really, I think a very good mix and fit there. So thank you for that question and comment. All right, remember, don't need to email me. I'm going to send everybody who's registered today these slides, a link to the recorded webinar, and a certificate for CEU, hour of CEU. So if you didn't get it, don't email me, check your spam folder. Because of the attachments, sometimes it gets sent to your spam. Thank you guys. Keep up the good work. Let us know if we could help you in any way, and have a wonderful, wonderful day or evening, and do stay in touch. And I hope to see you in future webinars. Thanks, everybody. Have a great day.